Hello and welcome everyone. I'm Suchitra Dalvie. I'm coordinator of the Asia Safe Abortion Partnership. So what we are hoping to do as part of this series of conversations is to try and unpack these very deep questions and bring for these conversations, bring along people who can offer a very unique perspective and can offer some insights into understanding what the issues are and where they are going to lead. So we're absolutely delighted to welcome to this conversation our guests from across the region. We have Son Lê here with us, who is co-founder of the Vietnam Youth Action for Choice, a youth advocacy affiliate of ASAP, which is based in Vietnam. Currently, he's in Australia pursuing his master's, and we are really grateful that he's here with us, although he's in a later time zone. Our second guest here with us is Manisha Gupte, very well-known, very well-respected, very well-loved feminist and activist, and we are so grateful that she has been one of the lead trainers at our youth advocacy institutes at ASAP for the last 10 years or so. She's also co-founder of a rural women's organization called MASUM, which is based in India. And she has also been part of the very first movement of activism which emerged in the women's rights movement around the whole sex determination conversation. So we're really looking forward to your perspective on that. We would also like to welcome Anand Tamang. Anand ji is a steering committee member of ASAP and also director of CREHPA, which is based in Kathmandu, which stands for the Center for Research on Environmental Health and Population Activities. Thank you very much for joining us. And of course, we would like to welcome Yu Yang, who is also a steering committee member of ASAP, based currently in Shanghai in China. And we're looking forward to perspectives from there as well. So in my first round of questions, I'm going to start with Manisha. And in the global south, as you know very well, population has always been associated with negative words. It's either a bomb or an explosion or a problem. And with the whole sustainable development, carbon footprint conversation, we seem to be coming back full circle with, many of our governments promoting, like in India, for example, there's conversation happening around the two-child policy norm. There is discussion around sex ratio, again, as a numbers game. And in this light of this pandemic, where we are hearing cases of child marriages going up, access to contraception and safe abortion becoming more challenging, where do you think we are headed really? 25 years after ICPD, what trajectory do you think we are moving for politically?
I think that there is a backlash against democratic rights throughout the world, against gender rights throughout the world, and these backlashes exist because there is agency, right? So we're ourselves finding more and more in situations where we're dealing with fascist regimes, totalitarian regimes, also regimes that are getting more and more militarized and jingoistic, and cultural nationalism. And I think therefore the whole struggle is not just against the issue of the population policies, but it's beyond that. So I want to present this in maybe 3 or 4 different but connected segments. So the first segment is you started off with the ICPD so the first time you had the development in the population conferences. So in that sense, it was a discussion further. But if you go to the conference prior to the prior, so in Bucharest in 1974, there was a whole discussion about resource consumption and population. In Mexico, the US government lobbied with 85 countries to sign and say that consumption would not be discussed in the population conference in Mexico. And then the ICPD came back again and then discussed it in the context of resources. So if we this is one piece. So in that sense, it was a gain, but the gain was after having been washed back in the Mexico conference many miles back, and then coming back a little bit further. But at least it was a gain that brought us a bit further. Right. The second piece I want to talk about is this unresolved debate between the Malthusian approach and the Marxist approach. And here I want to say that we cannot understand Malthus out of context. So in Scotland, what happens is that land is getting consolidated into grazing pastures. And now suddenly people become population. And there are too many people because now there's land is consolidated. And so people are put in boats and sent across the Atlantic into Northern America. And so there's a whole genre of writings around Malthus. So it's not out of context. Now, what they tell us in the whole population, the bomb, the ticking bomb, etc., is that if you had like one piece of bread And if there are two people, it would be two pieces. If there are four people, it would be four pieces. People, everybody would be hungry. But what they don't tell us is the obvious truth that the bread is not distributed equally in the first place. And that brings us to the discussion around what Marx says about the redistribution of resources. So we can talk of overpopulation, and here let me say that overpopulation is a consequence of poverty, not the cause of poverty. So this is why poor people will have more children, is because all won't survive, all won't be economically won't become adults who bring in the same economic gain to the family as, say, somebody in a middle class would. And so therefore really development is the best contraceptive. Now in Scotland you find that land suddenly, there are more people. Let's go across the Atlantic to the Mississippi plains, where first let's remember first the genocide. Yeah, the genocide of the native people, the First Nations people, happens, and then that land gets captured by European colonizers. I would not say settlers, I would say colonizers, imperialists. And then now, because those plains are so fertile, you require people to work. And I think this is another debate, which is from fascism to resources. They're not linked with each other. So who does the work? It's not us who do the work, it's them that do the work. Yeah? And so therefore then you have slave trade from Africa who come and work on your farms. And therefore then the land consolidation and the fertile land in the Mississippi. So the resources exist in both places. It exists in Scotland, exists in the Mississippi plains, it exists all over the world. You see Africa, which is one of the most rich rich places. What happens in colonization? The resources get taken away. So this is what happens in Mississippi. Now, in neoliberal globalization, what happens is that the product can travel, but the producer cannot.
Right.
So people are exhorted now to produce people like us and not them. So the us and them, that is the core fascist ideology, exists here. Now, what happens after slavery and after sharecropping? In slavery, when a slave woman was beaten, they dug a hole in the ground. They put her tummy in that and they beat her back, because there was a resource growing inside that the white massa could sell as a puppy or as a kitten, as a pedigree. Now, after sharecropping, suddenly the black body becomes a population. And now it's very interesting. Dorothy Roberts, if we see Killing the Black Body, if we read her, if a woman is on drugs, a black woman is on drugs, what they call the welfare queen, the teenage mom, that's eating off all the resources of the United States. Never mind how the resources were built. And here I'd like to quote Michelle Obama when they said, "Are you the first black family in the White House?" She said, "No, the White House was built by black people." So black people were always inside the White House. Yeah. So therefore, if you find, then the black body suddenly becomes an issue. And just again, what is the answer for this woman who might be on drugs, who's trapped, and the baby is taken away without her consent? It's Norplant. If she takes Norplant, which is a long-acting hormonal contraceptive, then she doesn't go to prison. And so therefore, I want to bring the whole debate to resources and consumption, and understand it in that context. Now, what happens among the poorest people at this point, with the two-child norm in India, maybe one-child norm in Canada, in China, the poor get disenfranchised further. So what happens in India? I work in the villages. What happens is you take away the right to participate in elections. So a woman who has people who have more than 2 children cannot participate in contesting elections. They don't get subsidized food on the ration cards, and no maternity benefits. Now, maternity benefits don't exist for more than 2 to 3% of women in India, because they are in the informal, unorganized sector. Rather than universalize maternity benefits, you're talking of taking away from those who you haven't even given maternity benefits to. So the poor get further disenfranchised. Now, I think this is an issue of who has the resources, who don't have the resources, who can decide who are people, who can decide who are population, and who can decide whose number to reduce, when actually we know that the carbon footprints as well as the resource consumption of the rich countries is much, much higher than it is in China or Vietnam or Nepal or India or the global south.
Absolutely. Thank you, Manisha, for the setting the tone of this conversation. And this is really the biggest of the big issue questions probably facing us right now. As we talk about sustainable development and all the population policies across the world. And in continuity to that, my next question I will ask Yu Yang. If you could just reflect a little bit about the one-child policy in China and how it has been for you as someone who works on the issues of sexual and reproductive health and rights. And now that the government has eased off the one-child family norm, do you think it will have an impact on the way people are able to access contraceptive methods or safe abortion? Because the government is now encouraging larger families, from what I understand.
Okay, thank you. I think for my part, I will just share some facts first. As Suchitra said, like in China, in 2015, we have amended the population and family planning law. According to the amendation, in the Article 18, and it says the state encourage every family has 2 child, and also in this amendation, the encourage late marriage and late childbearing was also removed. So in this context, I also found that but this how do you say, the government is still provide the free basic contraceptive service to the couples, and in the law, like to the couples without violation of the family planning laws. So in the past, because we have the one-child policy, so many couples cannot get the free service. But now, from the media or from the public media, few of cases were reported, like someone who get violated the new family planning law. So I think the service is more the access to the free service, contraceptive service. Maybe it's more easy, but the problem is only for the couples.
So married, you mean married couples?
Yeah, married couples.
Right.
So if the single women or even like young girls, I talked about a lot about young girls before. They still need to go to the small clinic or private hospital.
Right.
And there's one thing. There's another thing. I also found a quite interesting research. Actually, they just collect the data from April to December in 2018 in a quite famous women's hospital in Beijing, in the capital. And they found that in all the 1,773 abortion cases, and in those cases, there are 1,095 had one or more abortions before. Okay, so the abortion rate is almost 62%. Okay, actually, I shared a survey like my organization I worked before, we did before. We found there is high rate among young girls, young people. They have a high rate of retake the abortion. But in this research, they found more than let me check, more than 80%. They are aged from 30 to 40. So for married women, they more than they have more than 1,000, a lot of more cases to seek the abortion more than once.
Right.
So on the one hand, abortion is free in a lot of public hospitals. They are free for those married women. But on the other hand, it is really safe for them. We just provide the free service to them, but the I mean the education. Yeah. I did a lot of peer education before, but I never conduct any education among the old generation than us. But in those cases, they also found like nearly 80% of the women, they're aged from 30 to 40s, and all of them, they get married.
Right.
So in conclusion, I have to say, okay, the governments provide a lot of free service to them, especially for the abortion. For the couples, for the married women, they don't need to pay for that. But it's really safe. So it's a current situation, what happened here.
Right. So that's very interesting observation that, in terms of accountability or empowerment, and whether these are informed choices or these are out of a lack of choice. As you said, if the young people who are unmarried are not being given the education and access, and then they when they are married and they are older, they still don't have the information. So the only way they can control their fertility is by having maybe, more than one abortion. So that's a very interesting debate. So my next question is for you, Anandji. Abortion was criminalized in Nepal till 2002. And since decriminalization, we know that maternal mortality dropped significantly, and there have been many gains for women's health. But in recent years, there is again some conflict being created by the whole sex determination dialogue, as well as some of the anti-choice movements which have come in to the country. So do you want to reflect a little bit on that and what kind of impact it is having on population policies or SRH programs in the country?
Thank you. Before I begin, let me link how Nepal stands as compared to India and China in terms of population policy. Okay. Fortunately, Nepal did not have any state-sponsored, fertility control like in India and in Nepal or in China. Our population were allowed to, grow us depend upon how the family would like to do, have as many children as they like, and these were obviously controlled by factors like access to employment and job security for the children, and obviously the preference for a son. So son factor was very strong. Now fertility has declined drastically from 4.1 to now 2.3 in the last 1 decade. And 1.5 decade, and these are basically we can contribute to the contribution of the family planning, and also in the sense that the couple of today do not want to have many children. They have their own self, desired family size, and which have never been controlled by the state or by any society. Our son preference is very strong. As a result, we have other implications, which I would like to discuss later on. But when coming back to the abortion, like Nepal has really been one of the very good example where we have a very progressive abortion law. And just to tell you now, just 2 days ago, the government have now approved the directives for implementation of the 2018 Safe Motherhood and Reproductive Health Act, which includes a wider, rights for adolescents and the women to have safe abortion service free of cost. So that has been the directives have just been approved. So it's a very good thing, because earlier when we were in Bangkok, we know that this was one of the big hurdles, and many women who have there are women who have been imprisoned for the crime of abortion even now. So from the legalization of abortion in 2002 to the present status, we have, the government have been very much, reluctant to push ahead or expand the second trimester abortion. That's for the fact that the studies have shown that there has been a sex ratio imbalance at birth in Nepal, and is showing up and trying to follow the lines with China, India, Vietnam, and many other countries. So as a result, the government although safe abortion is accessible, there is no restriction in women accessing safe abortion services from a certified clinics, but expansion of services for women living outside the urban areas or in other districts where large-scale hospitals are not available for providing second trimester abortion. This is a big concern for the woman if she need to have a late decision on the termination of abortion. So as time now, since we have just passed the regulation for the Safe Motherhood Act, which allows women's access to abortion until conditional abortion until 28 weeks. Now, this has created a new paradigm for the women to decide and make a late decisions, which could again make some of the critics of abortion rights and pro-choice regarding sex-selective abortions. Sex-selective abortion in the country at the present situation is been, it's a private effort for the family. It's a private decision of a family, and the government is also reluctant to, talk against anything in favor or against, because the law itself has made sex selection illegal, sex determination test and abortion in terms of the termination in base of the sex of the the fetus. However, the practice, as I said, has been growing, and thanks to the modern technology that women can access to the ultrasonography to have their fetal sex determined. Or even now, we have a neighbor country, Nepal, where women can easily access those facilities across the border in India. So there is no much of conflict regarding whether or not to expand second trimester. Even the women who we have interviewed are in favor of a choice to go for sex selection because they are quite protective about their fertility and said that there's nothing wrong if a woman have two daughters and try to terminate a pregnancy which still will be a female fetus or female child. So the need for a son is so strong, and it is been controlled. It's been is a long social, cultural, and religiously determined factors that normally that propagate the strong son preference in the country. But there are community in Nepal, or I should say, the Nepalese family are basically very much insensitive to the sex of their first child. They would like to welcome whether it is a son or daughter, just because we don't have a single child policy like what China had before, where the daughters are hidden and not registered in the past. But now the story is no more there. It's now we have a different story for that. And even in India, where there was a pressure to have only 2 children. But in Nepal, the society demands that at least a family, if you are married and you are a married couple, you should have at least 2 children. Now they have, though there is no pressure to have daughters, but the need for a daughter also, it emerges once you have your desired sex of your child is complete. Like if you have 1 son or 2 sons, then the demand for the sons, the daughters also emerges. So that way, our present, the social, cultural, conditions in relation to fertility control are a bit balanced and a bit mild, preference for son, but son preference still exists in the country. So, sex selection is emerging in the country just because they want to keep their fertility, having a low fertility. They don't want to have more than 2 children, or in the urban areas, especially where women are educated and rich, they go for sex selection just to have, not because that they've been pressurized by the fear of not getting a job for their children or for their daughters or for their son, but just because that they are quite happy with a small family size. So the deep reason behind why you wanted to maintain a small family is need to be further studied using more of a qualitative ethnography study, because of the fact that our fertility rate has declined drastically from 4.1 to 2.3 in the last 1.5 decade. However, the CPR, the contraceptive prevalence rate, has remained stagnant for the last 1 decade. So the reason, even then, though many women have stopped using modern method of contraceptives, but fertility they are able to maintain the fertility to less than 3. So there is a magic, there's something fishy going on, how the women or the couple maintain their fertility or try to, balance between not having access, not using a family planning method, a reliable family method, which is free in all the government sectors or in many of the NGOs, and then controlling the fertility, trying to get rid of the unwanted pregnancy. So these are a big, issues that need to be further researched in Nepal.
That's great. Thank you very much, Anandji. It's a very interesting perspective, and you brought up some very key points, in terms of the sex selection. And this is something Manisha knows. I often talk about that when we say the word sex selection, we tend to forget that there is post-birth sex selection also. And in many parts of the world, in our part of the world, there has been, earlier there used to be a lot of female infanticide. So after the girl was born, they would get rid of her because, they didn't want daughters. And also the whole conversation around small family by choice. So wanting to have less children, but wanting to make sure that they are of the sex or the gender that one chooses. Because earlier you could have 6 or 7 children and maybe end up with 1 or 2 boys, and that was okay. But now you don't want to have that many. You want to have only 1 or 2. And therefore the push towards sex determination. Again, it's interesting to me to bring back the framings that Manisha spoke about, that, the desire to have a child of either sex is affected by the fact that the child of either sex is going to have a very different pathway in life. A boy is going to have a very different life. A girl is going to have a very different life. If both actually had equal lives in terms of their social, cultural, political, economic context, maybe it wouldn't matter really whether you had a boy or a girl. So the whole patriarchal conversation, the population control, and as you said, the whole mysterious gap between contraceptive prevalence but fertility rate. And I think that segues very well into the question I wanted to ask Son, because we know that Vietnam has always had a very high prevalence of contraception, but also a very high abortion rate. And in recent years, even in Vietnam, the conversation around sex determination is happening. And recently, I think the government was proposing a policy which would curtail second trimester abortions in the belief that, that might help with sex determination. So can you tell us a little bit more about what is happening in Vietnam?
Yeah, so thank you, Dr. Suchitra, and also Manisha and the other speakers. I think the conversation that we are created today is very interlinked. It's linking together, and I see that I can see that the issues that we discuss about abortions, population, and sex determination is like happen across borders. Like even in our countries, we face the same situations. And before I address the questions about why Vietnam also have a very high prevalence of contraception use, but then also we have the high rate of abortions, and yeah, comes to the detail about the curtain of the second trimester. I want to also provide the context of abortion politics in Vietnam to to link with the issues that Manisha's talk about, the populations and like neoliberalism and the other things. So it's interesting to see that although first I want to acknowledge that abortion is legal in Vietnam up to 22nd weeks of gestation, and is very safe according to many medical reports. The reason I want to acknowledge it because it's always the discourse in the public to say that abortion is dangerous, abortion is not legal as a country, which is not right. So it's very clear about this. And But then abortions become legalized in around like 1960 or 1963, after we get rid of the colonial law, which banned abortions. Then when abortion becomes more like common, and the governments like introduce like abortions at that time, it's not a rise for women. I would say that even it's recognized and in the law, but the way government use abortions to like for women is not the right-based approach, but more like the tools to control the population.
Right.
You know that because when it comes from the like after the war, and then Vietnam entered the renovations areas, the đổi mới eras, and then they want to seize the populations. They want to control it to make the households smaller and like reduce the populations. That is the main purpose of the government. That's why abortions became so popular and provided with many incentives and encourage the women to have abortions without any like proper counseling and information for women, and it's not right. So until the 1989, abortions finally acknowledged as the rights of the Vietnamese women, and from that abortion discussion and conversation stays mostly in the medical discussion. So not really widespread in the public. In the public, we know about abortion. But we don't talk about it. So a lot of conversation about abortion, how safe it is, how can we access this, even the right information about abortion stay in the medical settings until I think until 2015 and 2014, when the Vietnam Youth Action for Choice established. And then I think young people was those who bring back the conversations to the public space. And actually it was a right time, because as Suchitra also mentioned that about the attempt that the government want to seize the second trimester abortion. And it happens in 2015. The government wanted to introduce a population law. Like when it's come to the concern about aging populations and a lot of quality of populations issues. Now the government want to have something they call comprehensive population law, and then abortion as a part of it. And instead of re-emphasize the importance of abortions, they think that they should ban abortions over 12 weeks of gestation, which is ridiculous. And and I think they had a very poor assumption about abortion at that time. And the first assumption is about sex-selective abortions. They think that the reason that we need to ban abortions, second trimester abortion, because at that area, it's easy to detect the sex of the fetus. But there's a lot of research in Vietnam actually confirms that why women delay the decisions for abortion, because a lot of things about like economic issues, the hardship, the influence of the families, and when it comes to their final decision, is the gestation is already enter the second trimester. And it's not about the reason about sex-selective abortions. I mean, sex-selective abortion exists, but it's not a main issue that women actually choose abortion. So we need to be very frank about that. And using sex-selective abortions as a reasons to introduce a bill is absolutely not a good thing, and they have no evidence about it. It's a gender issues. It's more than that. The second reason that we found from the government why they want is they think that abortions, they think that young people think abortion as a solution. Let's think about abortion. Let's think straight. Abortion actually a solution for women who face unwanted pregnancy. But then when it comes to young people, it's not about like because of having abortion so they can easily have sex. This is not that kind of logic happens. This is about, you know, like imbalance of powers when it comes to sexual relationships, sexual violence, and a lot of things happen. So it's not like, okay, young people, they can have sex, and then if they have unwanted pregnancy, they can go to the hospital or the clinics to have like quick abortions, something they call like quick abortion, quick solutions. And that is the moment that we found that there is a discourse of abortion within the publics, that the people think, and also the government think, that abortion is easy choice. Like if you have unwanted pregnancy, you just go and get rid of it. And this is not because a lot of researchers have done a lot of things, and you know, like the reason is like abortion is not that easy in our society, in the patriarchal societies, in the society that women cannot really practice the right choice, the choice that they have. But fortunately, during that time when Vietnam Youth Action for Choice, we had the conversations. We got involved in the conversations. We start the advocacy, and then we also invited. We were invited to provide your youth consultations, and then we called to remove the bans from the law. And then I think after a lot of conversation with different experts and professionals and different agencies and organizations, until now the bill is still there. It's interesting because they still keep the bill in the pending situations like status, but then we cannot see the banning anymore. So like they remain the abortion rights that has been written in the 1989 law, which is really good. I think it's a very good thing. But then this year's we have the new policy from the Prime Minister, and that policy doesn't really mention about abortion, but it's encourage young people, especially young women, to get married and to have to have baby. Okay. And they call it as the national responsibilities. And I think it's linked to the idea of social reproductions and the neoliberalism, when it's talk about why we have to keep reproducing, making more humans to support the economies of the country, to build the country. And this is a very toxic ideologies that happen in Vietnam.
Wow, thank you so much, Son. So much food for thought in what you said. Some of the key points that stood out to me was the fact that, like, even in India, we have the Indian Penal Code, which we inherited from the British Penal Code, which was drafted in 1860. And although we do have an abortion law which allows termination for pregnancy, as you said, it's kind of, it came about because many women were dying from septic abortions. So it was kind of to reduce maternal mortality, not really a rights-based law. It protects the doctor from criminalization in the Indian Penal Code. So it's interesting to see how much, even now in 2020, we are still suffering the consequences of the colonial laws that were imposed on us. The other point that I think you brought out very well was the fact that second trimester abortions happen due to a wide range of reasons. There are a lot of delays which push the woman into second trimester. And I've always said as a gynecologist that the second trimester beginning is a kind of an artificial divide. It's not like in your body you feel different if you're 12 weeks or 13 weeks, So if you, as you said quite rightly, decision making, getting the finances, finding the freedom to, move out and get the services, etc. So I would say about 80% of the women in second trimester are delayed for all these reasons. And definitely about 15 to 20% are probably for sex determination reasons. But, these kind of policies that governments and their responses immediately are so punitive. That they, don't mind punishing those 80% women for the sake of controlling these 20%, which brings me to the third point that you brought out very well, is this whole desire to punish women for their sexuality. Like if young women, young unmarried women can have abortions very easily, like it's such an easy thing to do. And now with medical abortion, that conversation becomes even more complicated. They're like, oh, it's so easy, you just have to take a pill. Because they want you to have a difficult issue. They want you to have problems. They want you to be punished for having sex when you were not supposed to. So again, we see the intersections of all those various systems of oppression. And that kind of brings me, neatly to the second round. Did you have something to add, Son? Yeah.
Yep. So I think the issue in Vietnam is like the way Vietnam performed to the international forums and conference is like, we are very progressive. We have the progressive law about abortions. We always have the policy that improve the quality of abortions. But then we always put the main goal of the country is like, we need to reduce abortions. We don't want abortions happen. And the most ridiculous thing is like, can you imagine that they put one of the indicators in the gender equalities strategies of the country is reducing abortions? It's like, how can you achieve gender equality by reducing abortions?
True.
Not the case.
True. No, it's amazing how they add 2 and 2 and make something like 245. Like we don't understand where they get these ideas from, because as you said quite rightly, reducing abortions cannot be a goal. When countries have passed laws which are restrictive and they have tried to reduce abortions, what happens is you end up reducing safe abortions, but you end up increasing unsafe abortions when the number of abortions remain the same. So these are actually very detrimental and very dangerous kind of policies to enact.